Today we will discuss about symptoms of kidney diseases. When, and, how, we realize about our kidney failure in our body. Okay, now I am trying to say about 15 symptoms of kidney failure. Number 1, fatigue, being tired, all of the time. Healthy kidney make a hormone, named erythropoietin, that tells your body to make oxygen-carrying red blood cells. As the kidneys fail, they make less EPO. With fewer red blood cells to carry oxygen, your muscles and brain tire very quickly. This is anemia, and it can be treated. In that what say the kidney patient to a doctor?
What patient said?
In that cases most of the patients said, I was constantly exhausted and didn't have any pep or anything. He also said, I would sleep a lot. I'd come home from work and get right in the bed. Number 2, feeling cold, when others are warm. Why this happen? Anemia can make you feel cold all the time, even in a warm room.
What said patient at that time?
I notice sometimes I get really cold, I get chills. Sometimes I get really, really cold. It could be hot and I'd be cold. Really good information. What is the next symptoms, madam? Number 3, shortness of breath after very little effort. Being short of breath can be related to the kidneys in 2 ways. First, extra fluid in the body can build up in the lungs. And second is, anemia can leave your body oxygen-starved and short of breath. Mada, please tell short what is anemia? Shortage of RBC in the blood. RBC means red blood cells, which is carry oxygen in our blood. Great delivery, madam. In that case, what say our kidney patients? At the times when I get the shortness of breath, it's alarming to me. It just fears me. I think maybe I might fall or something, so I usually go sit down for a while. Patient also said, I couldn't sleep at night. I couldn't catch my breath, like I was drawing or something. And, the bloating can't breathe, can't walk anywhere. It was bad. Number 4, feeling faint, dizzy, or weak. Why this happens? Anemia related to kidney failure means that your brain is not getting enough oxygen. This can lead to feeling faint, dizzy, or weak. In this case, when patient come to for treatment, what they say? In the case, patient most of the time said, I was always tired and dizzy. I got to the point, like I used to be at work, and all of a sudden I'd start getting dizzy. So I was thinking maybe it was my blood pressure or else diabetes was going bad. That's what was on my mind. Number 5, trouble thinking clearly. Anemia related to kidney failure means that your brain is not getting enough oxygen. This can lead to memory problems or trouble with concentration. What patient said? I know I mentioned to my wife that my memory, I couldn't remember what I did last week, or maybe what I had 2 days ago. I couldn't really concentrate, because I like to work crossword puzzles and read a lot. I would get up to do something, and by the time I got there I couldn't remember what I was going to do. Number 6, feeling very itchy. We want to the symptoms, sir. Of course, kidneys remove wastes from the bloodstream. When the kidneys fail, the buildup of wastes in your blood can severe itching. Delivery from patients? In this case, patient said to us, it's not really a skin itch or anything, it's just right down to the bone. I had to get a brush and dig. My back was just bloody from scratching it so much. My skin had broke out, I was itching and scratching a lot. Next symptoms? Next is number 7, swelling in hands or feet. In this case, failing kidneys don't remove extra fluid, which builds up in your body causing swelling in the legs, ankles, feet, and or hands. What patient said? I remember a lot of swelling in my ankles. My ankles were so big I couldn't get my shoes on. Going to work one morning, my left ankle was swollen, real swollen, and I was very exhausted just walking to the bus stop. And I knew then that I had to see a doctor. Number 8, swollen or puffy face. Why this happen? Failing kidneys don't remove extra fluid, which builds up in your body causing swelling in the face. What patient said? My sister, her hair started to fall out. She was losing weight, but her face was really puffy, and everything like that. before she found out what was going on with her. My checks were always puffy and tight. Sometimes they would even hurt. Number 9. Food tastes like metal. Why this happens, sir? A buildup of wastes in the blood, called uremia, can make food taste different and cause bad breath. You may also notice that you are losing weight because you just don't feel like eating. Patient's reaction? In these cases, patients said, foul taste in your mouth. Almost like you were drinking iron. I don't have the appetite I had before I started dialysis. I must have lost about 10 pounds. Number 10. Ammonia breath. This happened because of a buildup of wastes in the blood, called uremia, can cause bad breath. In this case, patients said, my husband always tells me I have fish breath. Sometimes my breath smells like urine and need to brush my teeth more often. Sir, could I disturb you? Sure. In case of kidney failure, have any effect on stomach? Of course. Next I will say about stomach and vomiting. Number 11. Upset stomach, nausea, vomiting. Why this happens? A severe buildup of wastes in the blood, uremia, can also cause nausea and vomiting. Loss of appetite can lead to weight loss. In this case, what patients said? Patients said, I had a lot of itching and was nauseated, throwing up all the time. I couldn't keep anything down in my stomach. Great delivery. Number 12. Getting up during the night to make urine. Actually, what happens? Kidneys make urine, so when the kidneys are failing, the urine may change. How? You may urinate more often, or in greater amounts than usual, with pale urine. You may feel pressure or have difficulty urinating. Sir, in this case, what say your patients? Patients said, my urine is what I started noticing. Then I was frequently going to the bathroom, and when I got there, nothing's happened. You think, hey, I've to go to the John, and you get there, 2 or 3 drops. I would get up 2 or 3 times a night and had lots of pressure each time. Number 13. Foamy or bubbly urine. Kidneys make urine, so when the kidney are failing, the urine may change. How? Urine may be foamy or bubbly. This can lead to an above normal amount of protein in the urine. Patient's delivery, the bowl would be filled with bubbles. Excuse me, sir. Could I add something here? Sure. Sometimes I would notice my urine being very foamy. So I made an appointment with the doctor. Some patients also tell this. Exactly. Number 14. Brown, purple or red color urine. Kidneys make urine, so when the kidneys are failing, the urine may change. How? You may urinate less often, or in smaller amounts than usual, with dark-colored urine. Your urine may contain blood. From my experience, some patients said, I was passing blood in my urine. It was so dark it looked like grape Kool-Aid. And when I went to the hospital, they thought I was lying about what color it was. Exactly. They also said, I thought I had a urinary infection when I first saw blood in my urine. Number 15. Pressure when you make urine. This happens because kidneys make urine, so when the kidneys are failing, the urine may change. How? You may feel pressure or have difficulty urinating. In this case, patients said to us, when you go to use the restroom, you couldn't get it all out. And it would still feel just like tightness down there. There was so much pressure. The pressure was so great, yet it would come out so slow. Like 2-3 minutes slow. I know what is going on here. Excellent delivery from you, sir. Must we need to care our kidney before affected? But when we are following symptoms of these 15, must you go to concern our doctor? Be happy, sir. Thanks for your excellent knowledge sharing to our audience. All of we are proud for you. It's okay, and thank you for your invitation here. Take care of your kidney. Be careful, every diabetic patient, about your whole body as well as your kidney. Bye. Bye.